This morning that this marks our 16th panel since we began the COVID-19 adventure, as I sometimes like to call it. This morning, once again, the panel is sponsored by the City of Steamboat Springs and Routt County in partnership with the Steamboat Pilot and Today. My name is Lisa Slitchman, and I'm the editor of the newspaper, and I will be moderating. Today's panel, we are going to be focusing on kind of a resilience recovery theme this morning, looking at our plans to transition to the next phase. We've been staying at home. Now we're going to safer at home. We have business starting to reopen. And so we are going to be talking to various business leaders, public health leaders about this topic. So I'll begin by introducing our panelists, and if you all would just wave so people, I think most people know you by now, but we'll go through this again. First of all, Steamboat Springs Chamber's CEO, Kari Stoller. Main Street Steamboat Springs Executive Director, Lisa Popovich. John Bristol, who is the Chamber's Economic Development Director. Routt County Public Health Director, Kari Ladrow. And Steamboat Springs City Council President, Jason Lacy. So we have quite a few questions to cover today, and I do want to remind people that these questions have been sent in by the community, and I do once again appreciate our panelists' willingness to answer questions from our residents. So first up, we're going to start with Kari. And so we are seeing our downtown getting a little busier. Businesses are reopening. And so I think there are still questions about what segments are open and what segments will be opening in the weeks to come.
Thanks, Lisa. Good to see you. Thanks again for hosting and having us here today. Between last week and yesterday, a few additional industries are able to function with mitigation protocol in place. That includes retail, personal services, and office-based businesses. Now, it does not mean that everyone is open. The office-based businesses, if they're still able to function from home, it is encouraged for them to do so. Some retailers have opened, some are gearing up to open, and then others are still waiting until for a little bit further out, as well as for the lodging ban to be lifted. So it's not a full sweep of everybody's open, full force, or anything like that. And again, there is mitigation protocol that has to be put into place for any business that is open. And then the personal services, I know there's some questions around what that includes. It does include high level like beauty services, and then also personal training and pet care, kind of like pet grooming and pet training. Those are some of the high level ones. And then landscaping, this is a prime time and an absolutely beautiful day to be outside working, and landscaping is able to function right now as well. Still waiting for more direction on, a couple weeks from now, what additional industries will be able to open, but those are the ones that have recently changed.
And Kara, remind us, how long is the lodging ban in place right now?
Yep, so the lodging ban goes through May 31st. So if everything goes according to plan, lodging establishments would be able to reopen on June 1st. There is a availability for essential workers to stay in short-term lodging right now. So there's some people who have been working on construction projects for a while that have been living in a hotel or a condo, and they are able to continue to stay there. The goal is just not introducing additional people into our community right now so that we can slow the spread.
Thank you, Kara. Next, Kari, people are very interested, wanting more information about testing. So what are the current numbers and demographics of positive tests, hospitalizations, and deaths in Routt County? Is the first question. And then as a follow-up, are we over the peak and ready to enter the recovery phase?
Thank you for having me, Lisa. I really appreciate the opportunity to talk to the community, first of all. As far as testing, I know there has been a lot of interest in the testing capacity within the entire community, within the medical community, within public health. Really, there's a comfort level that people feel about testing. And so I want to reemphasize our commitment to testing and making sure that people are able to access testing. So that being said, we have one dedicated Routt County public health nurse. We have 3 contracted nurses that the Routt County commissioners have authorized for us to use. And through our three contract nurses and our public health nurse, we've been able to test 926 individuals in Routt County, which is great. So we've done a total of 926 nasal swabs, the nurses have here. And then additionally to that, there have been 316 tests that have been done out in the medical community. And so our total right now for testing is 1,242 residents have been tested. And I know that initially when testing was first talked about, we had a pretty limited capacity, but we've been able to really grow our capacity and are now offering testing on Wednesdays and Saturdays throughout May. And we really want to encourage people to come through if they're symptomatic, if they know someone who has tested positive or contracted the virus. And as far as hospitalizations, UC Health reported that they've had 4 hospitalizations since the start of this pandemic. And one of those individuals was transferred to a different hospital. So we're looking at 3 hospitalizations locally since the beginning of the pandemic. And so I think that that's an important metric to keep an eye on as we're moving through the transition and recovery period. And so that's going to be something that Dr. Harrington and I and the county really keep a close eye on as we move forward. Unfortunately, I think the community is aware that we have had 5 deaths. And so not to quantify people's lives by a number, because that's really hard. That's a secondary impact of using a number to talk about people's lives. These are obviously very special people to those that they knew and loved. And so it's hard to even talk about that we have had those deaths, but we have had the 5 deaths at Casey's Pond. So keeping an eye on the death count for the community is obviously of utmost importance to the county, to the medical community, and to all of us that live here. As far as the peak of the virus and what we're looking at, I think with some level of moderate confidence, we can say that we have hit the peak. That is a cautiously optimistic view on it. We can say that our disease prevalence is low right now. We can say that we have a low hospitalization rate. We do have to recognize that there is disease still in our community because of what we're seeing at Casey's Pond and then the few other cases that we're seeing out in the community. So we need to remain vigilant, but those are all things that we're keeping a close eye on.
Thank you very much, Kari.
Mm-hmm.
Jason, next up, we're going to ask you a question. What recovery and transition planning is currently happening at the local level and the state level, if you happen to know that? And how do these plans all fit together?
Sure. Thanks, Lisa, for hosting us again today. And yeah, as of now, the governor's office has been working really since early on during this crisis to think about transition and planning for all of the next phases that we might see ahead. The governor's office is reaching out to communities across the state to keep us informed about what they're thinking, and they're asking for input from the different communities and counties around the state. So that's been very helpful. Of course, we also have formed a local group of policymakers from all of the municipalities around Routt County, as well as input from the business community like Kari, Stoller, and then also we have some input from some key personnel from environmental health at Routt County and public health, of course. And really, I think what's important to remember as far as any of the state orders or local orders that you might see, the governor's orders are really the minimum restrictions that we need to follow. And right now we're kind of in what I would call the phase 2 portion, the safer at home portion, as has been ordered by the governor. but we can be more restrictive at the local level, and we have been on a couple of things. For instance, the lodging order that we discussed earlier that runs through the end of May. And then also we have a little bit of extra workplace mitigation protocol requirement where all employees and customers have to wear face coverings. And there are some other particular items that, as far as sanitation and cleaning, that businesses have to follow. But ultimately, you know, we will have to follow what we see from the governor's office, with the exception that the governor did include some ability for a local variance from his state orders. And this is a little bit nuanced, but it basically, if our county wishes to apply for any kind of variance from the governor's order, then they can submit a written application to CDPHE, which is the Colorado Department of Public Health and Environment. And we would have to certify that the county has either low cases of COVID-19, or we can document 14 consecutive days of decline in the COVID-19 cases reported in the county. And then the county would also have to submit a written COVID-19 suppression plan that would be approved by our local public health authority. Also, a majority of the county commissioners and our local hospital would all have to sign off on any kind of variance for less restrictions on a local level. So I believe Eagle County is one of the only counties I've heard of that has done that. Not really sure we're at the level where the county would feel comfortable with us applying for that yet, but that is something that the governor has contemplated as part of his Safer at Home order.
Thank you, Jason. Next up, I'm going to ask Lisa and John this question. What advice, Lisa, would you have for companies or businesses that are returning to the work environment? We'll start with you, Lisa.
I think it's important for businesses to be fully aware of what all the mitigation protocol is, and to understand that that's all available on the county website. It's also available through the chamber as well. We have spent a good portion of last week handing out information, going to all the downtown businesses that are open, making sure that they understand what the protocol is. And then on top of that, my advice to businesses would be to stay nimble, to be flexible, because the practices that are in place right now may change. They may escalate, they may de-escalate, and that not every member of the public is as informed as the next one. So it's our responsibility to educate people as they walk into our businesses.
Very good. Thank you. John, what would you add to that? What advice would you give companies returning to the work environment?
Hi, Lisa. Yeah, no, I would certainly echo what Lisa said. Safeguarding your facility to minimize your location as a transmission vector is key. If that's an office or retail space, you know, whatever that is, and taking steps to do that. That's really important. Second, communicating with your customers the steps you're taking to keep them safe, I think is really key at this point. You know, if we're going to reestablish that consumer confidence, communications is really important. So communicating with your customers, also communicating with your staff best practices, so that you can work together as a team and collectively ensure that health and safety in that workplace environment is really important. Also, looking a little further down the road, I'd really encourage folks to do scenario planning with your teams, to kind of strategize around what could happen down the road and impacts that could happen. So utilizing the brain power of your entire team is a good thing to do. So just do some of that scenario planning, as well as considering, you know, taking time to enlist some of your vendors in your supply chain, what opportunities they're seeing and that exist, that how you could maybe adjust your business plan and adjust your cash flow. So that is a good opportunity there, as well as just keep an eye out for other business opportunities that may exist in your business plan. And then really, just engage your staff and be united in this and have strong communications and build them up. So it's challenging for everyone. So.
Thank you, John. Good advice. Kara, has an analysis, we talked a little bit about this last week, but has an analysis been done on the economic impact of the shutdown? Get a lot of questions about that. Kara, I think you're still on mute.
Sorry about that. I did share a little bit last week about the economic impact survey that we conducted. It did close on April 8th, so that was quite a bit ago in this new world. We had over 250 businesses respond. A few of the key takeaways were that 11% of the respondents estimated that they could survive just 1 to 5 weeks during this crisis, while another 27% said they could last 6 to 10 weeks. And less than half of the businesses said that they could survive longer than 11 weeks. All of that being said, a lot has happened since then. There's been a decent amount of federal funding packages that have come out and that local businesses have been able to access. So I think, that's hopefully extending some of those timelines a bit, but something that we certainly have been keeping an eye on. And then one of the major challenges that was voiced in that survey was the challenge or need to access capital. So we've been trying to connect members with those and any business we've been serving with whatever's available in terms of accessing capital. And then regarding unemployment, nationwide projections, I believe, are around 15%. And certainly towns in which tourism is a key economic driver will be hit much harder. From March 7th through April 18th, over 2,500 unemployment insurance claims were made in Routt County, which is 15% of the labor force in the county. Now that, I want to be very clear, that is not the unemployment rate. There's a lot of other elements that go into that, but 15% of the labor force from March 7th through April 18th did submit unemployment insurance claims. And it's, in comparison, the statewide in that same time frame was 9.4% of the overall labor force had made unemployment insurance claims. We will be sending out additional impact surveys to help guide certainly the work that we're doing. Also, Jason mentioned the transition planning. I brought information from results from that survey to that group and everything that Lisa and the city and the county are all doing. It's really helpful for all of us to have that information and have it updated. So we'll be sending out another one in coming weeks.
Great, thank you. Jason, we, for the past 5+ weeks, we've been kind of hunkered down and fighting this pandemic, and we knew there would come a time when we would start talking about recovery. And I know you guys didn't just wait till today to start talking about recovery. So can you tell our audience a little bit more about the recovery plan and who is involved in putting that plan together and what's included?
Sure. So the Policy Recovery Committee is really, it comprises a lot of people from across the county. It includes representatives from county commissioners. Doug Monger sits on this, as well as from the city. You have me and Kathy Meyer, who's our president pro tem, as well as Gary Suter, our city manager. We also have representatives from Oak Creek. That is Chief Wisecup down there, as well as Nikki Knoble, mayor, and Chris Johnson, who's also on their town board. From Hayden, we have Matt Mendisco, who is the town manager, as well as Tim Redmond, who is the mayor there. And from town of Yampa, we have Janet Ray, who's serving in that role. And we also have some other key people with subject area expertise that we really need. We have Kara's on the team helping provide business input. And then we also have Scott Kalman from Environmental Health, as well as our public health representation, primarily Dr. Harrington helping us out. So it's really a good group with a mix of policymakers as well as people with key subject area expertise. So that's really been valuable to have all those people on board. And I will say the core team has really been led in large part by Kara and Dr. Harrington and Scott Kalman, as well as Mo Demorat. I didn't mention his name, but he's our emergency management director here. He's been really helping a lot, as well as Robin Shepard, helping us with putting together the communication pieces related to transition planning. And really what the plan does is it lays out different phases for how we can roll out the lowering of restrictions in the future as we move forward. And we've tentatively laid out 4 different phases right now. And it really just gives specific recommendations on how various activities, events, and businesses should be conducted at those different phases. And those phases, the way we determine when phases should be, either, the restrictions should be lowered or tightened is really based on some key metrics or indicators that we'll use to measure how we're doing and to determine when it's time to either loosen restrictions or possibly tighten, because things could go in a good direction or poor direction depending on how things roll out over the next several weeks and months. And ultimately, I think it's just important to remember this is really a recommendation to the county commissioners. They will ultimately make the final decision on any local restrictions that might be in place, but they are definitely reaching out to this larger group and taking the input very seriously.
Thank you, Jason. Kari, we have a lot of questions about what is being done to stop the spread of COVID-19 at Casey's Pond, where we know all 5 of the deaths have occurred. And so I wonder if you could talk a little bit about, from your perspective, what's being done in that area. And then also we've had some questions about, the Haven as well, another senior living area, what's being done to monitor and stop the spread of COVID.
Sure. As we know, throughout the entire country, there have been devastating consequences of this virus, and there are currently in the state of Colorado 163 outbreaks in long-term care facilities. And so from the very onset of hearing about this pandemic coming to the United States, we really, in the health department, really had vulnerable populations as part of our radar of who we first and foremost needed to protect. And so the strategy going into this was really to focus on those areas. And in the initiation of the Emergency Operations Center, I brought on an epidemiologist who is the task force lead for vulnerable populations. And so she has been able to focus on the Haven, on Casey's Pond, on Horizons, on the various sectors of vulnerable populations, in order to make sure that they had the PPE that they need, because that's such a huge that's a huge national issue, making sure that staff have the protection that they need and the protection for the residents. So first and foremost, I want to give a shout out to Jenny Campbell has been our epidemiologist running the Vulnerable Task Force lead for those populations. And so strategically, from the very onset, we started the Vulnerable Task Force to take a look at who in our community is most at risk. And then from there, we developed a testing strategy. And so Casey's Pond, obviously, since there are so many vulnerable seniors within there, we focused on them with the limited testing resources that we had. And so our public health nurses went in very early on and were able to identify asymptomatic carriers there, which was, I think it was a huge prevention mechanism for Casey's Pond, for the community, in order to make sure that we had the data, but also the prevention in place to give it our best shots, to make sure that we were taking the best possible care of our vulnerable populations within the community. So sequentially, we went from Casey's Pond to the Horizons population to test the Horizons participants in addition to their staff, and then also the Haven. And we've done that several times in several different locations, but recognizing that early on, again, testing materials were an issue. we had to prioritize. And so that was the prioritization that happened right from the get-go, was to use our testing materials in that way. Then as the testing materials became more available, we've been able to open up testing, but we've worked really closely with Casey's Pond. Casey's Pond, their infection control nurse and their medical director could speak to their specific infection control procedures. Dr. Jimerson's very involved over there. But there is an outbreak, a CDPHE outbreak team that's assigned there that works with not only the county, but Casey's Pond together. And so it's really been a collaborative effort to try to protect the residents within Casey's Pond, within the Haven, our Horizons population. We've also worked closely with the integrated communities population, because one of the things we recognized was people who may speak a different language are at a disadvantage for information sharing. And so that was a priority in addition. So I would say probably one of the things that I'm the most proud of is the early intervention that we were able to do with some of our vulnerable populations, the 200 plus tests we did. It's an ongoing thing, and it's a worry. It keeps all of us up at night, as I know it does Brad and Dr. Jimerson, and obviously the families of Casey's Pond. So it's an effort that we're going to continue, and it's an absolute priority, and we recognize it. And just know that we have all hands on deck throughout the community trying to make sure that we keep our vulnerable populations safe and well.
Thank you, Kari, for that.
Mm-hmm.
So good to know. John, I'm going to turn to you now. Can you tell a little bit more about our local economic development recovery plan and kind of who is involved in putting that together and what is included? I'm assuming there's a plan. I guess I should start with that.
Sure, right. That's key for any of these, is that you have to have a plan, and you got to have engaged people to put it together. So we are working on that. I've been tasked to look at a long-term economic response plan, and so that's different than the initial. What Councilman Lacy was talking about, the initial recovery and response plan. I've been tasked with looking at the long term. So, what is a year, 2 years, 5 years look like for us? So with that, I've engaged 12 volunteers in drafting kind of crowdsourcing ideas here over the last month. We've been meeting over the last month for about an hour once a week, as well as doing some homework and lots of research. The federal government has restoreyoureconomy.org, so I've been relying on a lot of that content. There's communities, the analog that I'm looking at is communities that face natural disasters, especially those along the Gulf Coast, East Coast, with hurricanes or tornadoes, and they put together long-term economic recovery plans. And that's exactly what I've been looking at. So studying those and trying to pull out ideas that we can utilize. The next step in that is to pivot and engage our Economic Development Council. We've got 30 members on the Economic Development Council from all different industry sectors across the county, and engaging them in their brain power to look at it as well, because they've spent a lot of time thinking about economic development. And the key to economic development really is industry diversification. Just like an investment portfolio, you don't want to be overly invested in any one sector. And so we as a community want to think about that. How can we support certain industry sectors to ensure long-term sustainability and stability? That's really important. And just to give you a couple high-level points, in some of those plans, is you really want to be engaging key industry sectors. And so, as Kara was talking about, doing economic impact surveys. Well, the next step a little bit further is digging down a little bit deeper and engaging specific sectors. If that's engaging our outdoor recreation manufacturers, if that's equipment manufacturers or outfitters or others. Looking at key public institutions, how we engage them for what the future may look like around transportation, as well as large-scale civic assets. You think about arenas or performance venues. What does that look like, and will there need to be longer-term shifts? So really just asking some of those questions and trying to understand how do we prepare. We've as the Economic Development Council, we've really had a focus on 4 key sectors: supporting location neutral remote workers. That I think is going to be more relevant now than ever as people look for places where they can connect remotely, pushing broadband connectivity, as well as ensuring that we've got that transportation infrastructure. That's really important for location neutrals workers, as well as other sectors, such as value-added ag and arts and creative industries. That is also an important sector that we've identified, and will continue to do that in the long run. So I guess one item I would say to our viewers today is I am crowdsourcing ideas. So if you've got ideas, let me know. I want to hear them. If you know folks that are on the Economic Development Council, tell them as well. So we want to be engaged in this. It takes the entire community, and crowdsourcing ideas and information is very important. And I want to ensure that we're including lots of different perspectives in there. So thanks, Lisa.
Thank you, John. Lisa, can you talk a little bit about a Main Street recovery plan and what's involved in putting that together and what's included in a plan like that?
So I am part of John's group of volunteers working on that long-term plan. And for Main Street, long-term and short-term, we need to look to our pillars to inform us how we move forward. So Main Street is about preservation first. So Main Street was born out of the Historic Trust. And so our downtown, the historic qualities of our downtown are what inform us as we move forward. But among our pillars are also promotion and community. So we are working on how do we adapt some of the policies that we have in place right now to move forward. So we're working with the city and with the county and with the chamber to look at some of the restrictions that are in place right now that were already in place before COVID. So how can we adapt some of those policies to serve our community now so that people feel comfortable going to a restaurant or shopping in a retail store? So what does that mean for the short-term recovery over the summer? Does that mean the relaxing of some liquor laws? Does that mean the relaxing of some of the restrictions of putting merchandise on the sidewalks to make people feel more comfortable when they're shopping? So right now we're looking at those things that we can do immediately to help without going too far, because as you know, nothing draws a crowd like a crowd. So we all want to be busy, but we can't be too busy. So trying to balance that for our downtown community and for the community at large is where we are right now.
Thank you, Lisa. Let's see. Like I said, we've got a lot of questions and our time is we're halfway through. So Kara, let me ask you, how is the chamber changing its destination marketing efforts to respond to this transition period?
So the chamber has been responsible for the non-ski season destination marketing for over 30 years. The last 4 years, we have been focused on impacting specific timeframes, being late May, June, so early summer, and then September and October, as those were really our areas of opportunity. Typically, we flight our media campaign in mid-April to impact late May and then moving forward from there. We've been working really closely with the Colorado Tourism Office, other destinations, both in and out of Colorado, and travel research firms to understand traveler sentiment. And of course, all of that balancing with the state and county public health orders. The Lodging Association actually brought a recommendation to extend the short-term lodging ban out further, knowing that that would provide the health agencies, Kari, Dr. Ladrow, the hospital, with more time to slow the spread of COVID-19 and be able to focus on a smaller population. And also provide the community with a level of comfort knowing that other people aren't being continued to be introduced. As many of you know, a lot of events have canceled already this summer, and that will have a major impact on visitation overall, and then also in terms of, you know, large groups in one space. All of that being said, and you know what today is about is recovery, and it's finding that balance of you know, public health is first and foremost, but there's other implications that are quickly coming down the line with people not being able to work and businesses being able to function. Thankfully, we're starting to turn the corner though. And our marketing efforts have, as many people have in their businesses, been re-strategized numerous times over the last 2 months. Some key changes that we're making: we are taking Houston out of the Houston market out of our plan and really focusing in on the drive markets, knowing that people will be more apt to drive to a vacation rather than get on an airplane. And currently we are planning a June 1 campaign launch. As I mentioned, we typically start a campaign about a month before we expect to see visitor increases. So June will be slow, gradual start to summer tourism with the hope that July brings a bit stronger occupancy rates and we can increase fall visitation as well. But that's, you know, it is a moving target. Things are changing by the hour, by the day, but that's our current game plan.
Thanks, Kara. Kari, we have a lot of questions about antibody testing. So, you know, will this be available in Routt County? You know, is it accurate? And what do we know about immunity and COVID-19? Kind of 3 different questions there.
Sure. So first and foremost, I can't speak for all the medical providers in the community. I'm sure that people have heard that there is a lot of caution surrounding these antibody tests, as there should be, because they can give a false positive, which actually can be dangerous because people are presuming that they have an immunity and then can put themselves into a compromising situation, which obviously we don't want. So I would say overall to the antibody question and the antibody testing for the future for Routt County, I think it's going to come when it's time for it to come and when it's safe for it to come. And I think from at least my perspective as Routt County Public Health, we aren't going to start testing unless we know that we have a high accuracy rate with it. There's the science to support it as far as the levels of antibodies. And we want to feel confident as we're testing people that we're doing the very best service to our community. Not to say that other people may make other decisions within the community, which is fine. It's just a level of caution needs to be adhered to when we're talking about these antibody testing. It's become a little bit like the Wild West as far as the variety and the assortment of tests that have appeared that don't have FDA approval. They don't even have an EUA. And so I think while we all would like to know our immunity levels and would be able to approach the world in the normal way that we had prior to COVID, I think we need to be realistic about what these tests can and can't do. And as health professionals, I think we need to be very cautious about educating people, even if we are testing, as to what the capacity for these tests to actually test for is. So I would say caution would be my word that I would associate with those.
Thank you, Kari.
Mm-hmm.
Let's see. Let's go to, well, I guess, Kara, you again. How will the community approach and you've mentioned this a little bit, prepare for the remaining summer season, short-term rentals in fall? Do you feel like you've addressed that, or is there anything more to talk about on that?
Just a couple of items that I wanted to mention. Again, working with the CTO and local lodging properties, our goal is to help convey to those who do come to visit the expectations we have of them. Obviously, across the country, it's very different in terms of what protocols in place, what general practices are, and all of that. So we want to make sure that we're giving our guests an awareness and access to masks, thinking that those will still be required when you're in public space throughout the summer. So we want to make sure that we're putting that out first and foremost, but also want to make sure that our community remembers that people are coming from different places and don't have the same level of expectations. So it's totally okay to share and let them know that they need to meet our expectations, but in a kind, welcoming way that our community is known for.
Great, thank you. Jason, you're the guy we're asking all the questions out about different phases, but you mentioned, 4 different transition phases, recovery phases. So could you, go through those for us, and what specific metrics or data will be used to know when to either ease restrictions or, like you said, if things go badly, if we would have to, increase restrictions. So could you go over that for our audience, please?
Sure. So we realize this is very confusing for a lot of people. So we're trying as best as we can to make our terminology flow with what we're seeing from the governor's office. So the 4 phases that we've identified up to this point are, number 1, the stay-at-home phase, which is what we just rolled out of. And that's the most restrictive phase. And then the second phase is what we're in right now, which is called the safer at home phase, which does allow for additional businesses and offices and things to open, however, with some pretty strict mitigation protocol and guidance and restrictions. The next phase, phase 3, which would be the one after this one, as restrictions are eased further, is what we're calling protect your neighbor. And that would be the phase where, and I'll touch on the metrics in a second, but as we see these metrics going in a better direction, that would allow us to reach a comfort level to allow for, say, larger gathering sizes than the current 10 number that we're at right now, and also to allow for a little bit more looseness on how businesses and other organizations can operate, although they still would have some guidance and protocols that they would need to follow. And then the 4th phase would be what we're calling continue healthy habits. And that's really the last phase that's really when we have either a vaccine or a really effective treatment that can really make sure that we have, achieved a level of true safety in the community. As far as the specific metrics or data that we're using, it's a pretty comprehensive list. We are going to be monitoring the trajectory of the cases, see how that goes. That's going to be a really important factor. We're also going to follow the number of COVID-19 related deaths. We're going to look at COVID-19 hospitalizations. We're going to obviously track very closely our community testing capability, both, how many people we can test and how quickly we can get results, which we've vastly improved on that over the last few weeks. Contact tracing is another thing that's going to be very important, and the ability to issue those quarantine and isolation orders where necessary. And that's another piece that, as Kari knows, we've really improved a lot on recently. We're going to monitor our PPE, personal protective equipment supplies, to make sure all of our healthcare workers and first responders and people in the community have what they need on that front. But we're also going to monitor some things that maybe people don't naturally think about in regard to public health. And that's, we're going to really start looking at things like Kara was mentioning on unemployment, how that's looking. We're going to be looking at the economic loss on tax revenues to the county and to all the municipalities around the county. We're also going to be looking at 911 data for domestic violence and substance abuse and suicide and mental health issues. And we're also going to look at, how we're doing on some of these more qualitative measures, like use of face masks in public. How well are people doing with their maintaining the 6-foot physical distancing? How well are they doing on limiting group sizes, and how well are businesses actually adhering to the mitigation protocol? So that's a lot I threw in there, but, and obviously Some of those factors will weigh more heavily than others. They're not, kind of an all equal type scenario, because obviously, like if the case numbers were to really spike, that would, cause us, some significant concern where we would need to look at possibly tightening restrictions. But hopefully that will not occur. But that's kind of the basic list of what we're looking at on metrics.
Thanks, Jason. That's great information. Kari, Jason mentioned it, but what are our testing and tracing? What's that look like right now? And do we have the capacity to do the testing and tracing as needed to move from one phase of recovery to the next?
So the metric areas that Dr. Harrington and I watch pretty closely are those that Jason was describing earlier as far as our testing capability, and then also contact tracing. And just to clarify, so even from the initial couple cases that we received notification about here in Routt County, have done the contact tracing and the isolation orders consistently throughout all of these cases. What we've been able to do recently, which is great, and I'm so excited about, is to develop these contact tracing strike teams. And so we had, we brought on several people who worked for public health service agencies and the CDC who are contact tracing strike team leads. And these two individuals then have teams underneath them who are deployed once we are notified of a positive case. So how it works basically is the public health team, we're notified of a positive test result, and then we make contact with that person, explain the isolation procedures, do the isolation orders, and then do self-quarantine as needed for the household. But then from that point, we are able to turn it over to our contact tracing teams, and those folks then are able to utilize a really extensive interview questionnaire where they talk to people about basically their last 14 days, where they've been, who they've been in contact with, any risk factors to the community. And once they've completed this really thorough investigation, then are able to reach out to those contacts. And so it's sort of this spider web of contact tracing that we've been able to establish through these strike teams. And it's really, it really puts us in a much better position than other communities that don't have these resources deployed in order to contact trace, because once we identify a positive case, then we're able to really put a lot of dedicated time into making sure that those people that may be symptomatic are being tested, that they are aware of what the quarantine recommendations are, and that we can have a thorough investigative process associated with each individual case. So I'm just thrilled and really excited that our community is in the position to have these strike teams, and would like to express that we have had volunteers come forward to be on these strike teams. And these are people who are either retired healthcare professionals. They're people, we even have a student who was a Steamboat Springs High School student who came forward wanting to volunteer and serve the community. And so it's just a really a great testimony and tribute to our community and how invested people are to taking this seriously and making sure that people stay well. And so I feel really confident about our contact tracing teams and the work that they're doing. And I think it's just an exciting asset that we have to offer to the community. So thanks for asking about contact tracing. I could talk all day about contact tracing.
Thank you. That's so good to know. Yeah, that people are stepping up. So thank you.
Mm-hmm.
Let's see. We got a couple more questions, and these are kind of, I'll pose to each of you. So one is, what are some of the challenges that you foresee in this recovery process? So Kari, why don't we start with you? What are some challenges that you might foresee as we start opening up more and getting into this recovery phase?
I think making sure that people are still adhering to their own personal responsibility for keeping this virus under control. We do have the 5 commitments that several different panel members have talked about, but making sure that I have to put the plug in for people maintaining their social distancing, washing their hands, wearing masks in public, staying home when they need to, and getting tested. Those are our 5 commitments that are listed on the Routt County website and we have around the community. I think that's going to be really a paramount effort by every single community member who exerts personal responsibility, and we all have to commit to keeping this virus under control and for the safety and wellness of our entire community. And we certainly can do it, but just to reiterate, I think that is a little bit of a challenge just as people start experiencing some lessening of the restrictions. So I would just ask for every single person that's watching this to commit to those 5 commitments as we move forward. That's all I have, Lisa.
Is Lisa frozen?
I think Lisa may be frozen.
Well, while we're waiting for her, who else wants to answer that? Kara or John, you want to jump in on that?
I can jump in. One of the challenges that I foresee in this recovery is that the road being too long and too slow for businesses to make it. There have been grants and loans that are really helpful, but they won't solve it long term. The PPP loans are amazing, but they really are helping the employees, which is wonderful, but it's not going to necessarily be what saves a business and makes sure that they get through this on the other side. Low consumer confidence, I think, especially with purchases such as vacations, outdoor rec gear. This just might be a longer haul than many can bear. So that's my concern. I think we have a lot of absolutely amazing, incredibly bright people in our community who will come up with wonderful new ideas and concepts for their businesses to keep going. So I do have hope, but that is a challenge that I'm concerned about.
Hi everyone, this is Bryce, Digital Engagement Editor with The Pilot, and today, unfortunately, Lisa is having some technical issues. So she asked for me to ask the final question, to go around and, oh, here she is. Never mind.
No, Bryce, go ahead. Where are we?
No, that's fine. You can go ahead and ask the last question.
Lisa,
Okay.
we were just finishing up the answers on the question about the challenges that we foresee in the recovery process.
Okay. Thank you. Sorry about that. Our internet went down. So the joys of Zoom. So I guess the last question before we close is basically going around and asking you guys to give individuals, businesses, anyone advice as we enter this phase, this safer at home phase, and then go on to our protect your neighbor, and then the hopefully continue healthy habits phase. So we'll start on this one with Lisa.
Okay. Well, I would say to the public in general, come downtown, wear your mask. Get used to wearing your mask. Learn to love it. Buy several masks that match every outfit you have. Get used to it. The sooner we adapt to some of these new normal things, the more comfortable we can feel, and the more we can get back to seeing those people that we love, that we don't get to see every day. These calls are how wonderful is this technology that we can sit and have this meeting and everyone can be included. But, there's faces on this screen that I miss so dearly. So I'm really looking forward to that time. And if we follow the rules, if we follow those 5 commitments, we can get back to a point where we can maybe be in the same room. Won't that be nice?
Yes, that's something to look forward to for sure. John, what advice would you have for individuals or businesses?
Yeah, the key piece of advice I have for businesses is that, the direct impact here is obviously a tourism and hospitality sector. But if you're not in that sector, be thinking ahead, because this will have larger impacts across the economy. And so I'd really encourage folks to take time, go to the Chamber's website, and download the Disaster Recovery and Continuity Guide. It's a large packet, but there's a lot of good information and planning tools in there for businesses. I really would like to, I'm hopeful that folks can look further down the road and start planning ahead if they haven't been directly impacted as of yet. And then also lean on the local resources we have here, you know, both technical and financial assistance. Contact the Yampa Valley Entrepreneurship Center, the Small Business Development Center for technical assistance. Also talk to your bank and others for financial and lending assistance. That's really important right now. So don't shy away from asking for a little bit of support and insight. And last thing, one plug for the long-term economic recovery piece. Like I said, crowdsourcing ideas. Love to hear any thoughts and ideas out there. Send them my way. Email is john@steamboatchamber.com. Thanks.
Thank you, John. Jason, what advice would you have?
Yeah, I think it's really going to be key right now for everyone to look for creative ways to adapt, both in their business life and in their personal lives. It's really, flexibility is going to be key. This is going to be, it's been a hard time for everyone, but I think it's good to see we're finally starting to see some of that light at the end of the tunnel. And I think we need to focus on that instead of, the negativity that it's always easy to focus on. And then I would also say, just never hesitate to reach out to any of the policymakers, any business leaders, anyone in this group, or anyone else that you have with questions, concerns, ideas, or suggestions on how you think things can or should improve. None of us have a perfect playbook on this to go step by step. So, we really need and value everyone's input, and constructive criticism is always welcome.
Thanks, Jason. Kara, how about you? What advice?
Great advice has been shared. Definitely make sure that you work on your relationship with your local bank. I think certainly people have tapped into loans and grant opportunities, but don't let it stop there. Make sure that they understand where you're at overall and what the future looks like further down the road, not just the next couple of months. It's really helpful for them to have a deep understanding of how your business is functioning financially. And then I have been hearing a lot about consumers and how are things going to change after this. I would say in a broad stroke, millennials are already there, but consumers are going to want to know even more about their business and know that they're supporting ethical, community-minded businesses and have that validated by fellow consumers. So take this time to connect with your loyal customers and have them write recommendations and reviews for you, because it will be really beneficial down the way. And that's something that individuals can do right now. Show support, certainly, by getting downtown, getting out to the businesses that are open, buy gift cards for those that aren't open right now, get takeouts, and then reiterating what Kari has shared, just the personal, or everybody has shared, personal responsibility on those 5 commandments, I think is what we're calling them. Wearing a mask is appropriate. It shows that you are, you want to take care of your fellow neighbor. That's what it's about. So let's keep doing that. Let's keep washing our hands, and hopefully each step of this will be able to do as we hope, sooner than later.
Thank you, Kara. Kari, what advice would you have for individuals or businesses?
I would echo all the sentiments that have already been stated, and then also add to make sure that business owners are taking care of themselves. We recognize this has been an incredibly difficult time for many of the all of the business owners here in the community. And so I think making sure that there is recognition of this has been a very difficult time. And as Jason said, we have hope and we have light at the end of the tunnel. But just to make sure that business owners are also taking the time to take care of themselves in addition to their employees, I think is really important as well.
Great, good advice. So we have done it. We are down to the end. And so I'll let each of you guys just say something in closing to our audience. So John, we'll start with you.
Just reiterate, if there's ideas for long-term economic recovery, I'd love to hear them. Please send me an email. Email is johnjohn@steamboatchamber.com. This long-term economic response is really important for us as a community for long-term stability and sustainability for the community. So love to see and hear some great ideas to be included. Thank you.
Thank you, John. Jason, how about you?
Sure. I would just say, I would just really encourage everyone to continue supporting each other like you have to this point. If you can donate funds to any of our great nonprofits that are filling huge needs right now, please do it. If you can buy products from a local retailer, please do it. If you can buy breakfast, lunch, or dinner from a local restaurant, please do that. You can use the services of a local service business, please do that, or go out and buy gift cards. Our business community really needs your support. And also on a personal level, check on people that you think might be in need and take that time for self-care. It's really important to take care of yourself so you can help take care of others. So always remember that. And in short, just continue to show the amazing generosity and spirit that exists here in Steamboat and Routt County. We really need each other now more than ever, so just keep supporting each other.
Thank you, Jason. Kara, how about something from you in closing?
Just thank everybody for taking the time today. And I couldn't encourage people more to connect. Business owners connect with myself, with John, with Lisa, with Jason, with anybody to make sure that we know what's going on, what your challenges are, but also what are your new opportunities that you're taking advantage of so that we can help be a megaphone for you. And then, as mentioned, connect with your neighbors and friends and make sure everybody's taking care of each other. It's okay to take some time away. It will all be here in hours later or days later. I know it can be hard to break away, but it's really good for everybody to come back refreshed. Shop local and wear your mask.
Thank you, Kara. Kari, how about you in closing?
Just would like to thank everybody in the community for their support of this effort. It really has taken a village in order to get the work done that we have, and all the people on this panel, and you, Lisa, and Kari Harden, and the commitment from the EOC and Mo DeMorat and the commissioners. I mean, it's just been, it's been touching to see how many people have invested so much time and energy into keeping all of us safe and healthy. And so I just would like to express appreciation for that and wish all the mothers that are listening a happy Mother's Day for Sunday. So thank you for having all of us.
Thank you, Kari. And Lisa, we'll let you have the last word.
Well, we are really truly blessed to live in the community that we live in, to live here in Steamboat Springs, which is really, I think a lot of us have grown to appreciate over the last 6 weeks just how lucky we are to be here. We live in a beautiful place, and we live in a community where people really do support each other and care about each other. So thank you to everyone that I get to be here, because I feel truly blessed. But don't forget to reach out to each other. Everybody on this screen today is someone who can help you if you have an issue. And if you have an idea, we are not shy people. So I've heard from lots of people who've had some really incredible ideas over the last few weeks. Keep them coming. And if you're feeling down, because it's hard to stay focused right now, just look out the window. We live in the most beautiful place on the planet. So just remember that and stay safe and stay well.
Thank you guys so much. I just feel very grateful for your leadership and for your hard work during this time. I woke up kind of feeling blue today. I'll admit it, because I think it's important that we admit when we have good days and bad days. And I arrived at the office with a lovely handwritten note from the Yampa River Botanic Park, thanking us for our work and a nice flower. And it was just, that's what we do for one another. And that's why connecting and doing those little things mean so much right now, those little kindnesses. And I hope everyone smiles big underneath their masks, because you can see it in people's eyes. And everyone stays safe and healthy. We will have another panel on Friday. We will be focusing on our ag community and checking in with them to see how COVID-19 has affected them. And I know we've seen a lot of really creative things as well coming out of our ag people. So we look forward to that conversation. Again, please send your questions to covid@steamboatsprings.net or to news@steamboatpilot.com. Please get outside safely and enjoy this beautiful day. Have a great day. Bye, everyone. Thank you.